Wonderful. Now, moving on to this discussion for this session, we've heard through the various discussions and the speeches how critical the next few years will be for Africa if we are to meet universal healthcare targets by 2030. It's not a lot of time. Now, this next session will help put things into perspective as to where we are as a continent in this journey to UHC. We'll be delving into the State of UHC in Africa report that reflects on the successes, the barriers, and the lessons learned along the way. Now, without further ado, because time is not on our side, allow me to introduce my distinguished panel. We have Dr. Solange Hakiba. She's the Chief of Party at USAID Rwanda, heading the Integrated Health Systems Activity Project. Also the co-chair of the AHAIC Commission. We also have Professor Edwin Baraza, Director of the Nairobi Program at the Kemri Wellcome Trust Research Program and head of the Health Economics Research Unit. He also co-chairs the AHAIC Commission. We also have Dr. Shakira Chunara, who is the Youth Ambassador with the African Union, a public health practitioner, and Operation Smile Ambassador for South Africa, as well as an AHAIC Commissioner. We also have Honorable Gabriela Cuevas Baron. She's the co-chair of the Universal Healthcare 2030 Steering Committee and a member of Parliament in Mexico. And last but not least, we have Linda Arthur, who is the Africa Implementation Leader for Vaccines, Global Public Health at Johnson & Johnson. I want to make a very humble request to my panelists. If we can keep our responses very brief and concise in the interest of time, so we can get as much as we can through this session. Now, Dr. Hakiba, let me begin with you. This report is a massive undertaking. Congratulations are in order. And as one of the co-chairs, what has this experience been like for you? And just curious to know some of the individuals who were on the commission with you and what guided your work. I believe we have a slight technical difficulty with Dr. Hakiba. No problem at all. We will quickly move to her co-chair. Professor Baraza, I hope you are with us. Coming to you and just to understand what this undertaking entailed. It is a huge one considering what you had to gather in terms of information from the continent and where we stand on universal healthcare. What did this process entail?
Thank you very much, Victoria. I hope everyone can hear me. The commission was put, it was put together in November of last year. And so we've had 3 months of intensive work trying to answer 3 questions. The first question is really taking stock on where we are as a continent with regard to the achievement of universal health coverage as a goal. And secondly, interrogating some of the challenges that the continent faces and the opportunities that the continent has to accelerate progress. And lastly, to think through recommendations. The work has entailed a lot of deliberations across the commissioners. We have 11 commissioners across 10 countries, a lot of deliberations between them. They bring together a lot of experience and diverse skills. It has also entailed standard research, so carrying out literature reviews, extensive literature reviews, and carrying out interviews with people across the African continent at the country level, and also talking to people at the regional level, key informants, people with information on universal health coverage at the continental level. And the most exciting part of our work has really been hearing from people in the streets, as they say. So people that do not work necessarily in the health sector, people that are not necessarily politicians or technocrats and so on. So we carried out a call for people out there to give their stories, to give their personal stories about their experiences of UHC from the different countries. So our work has entailed bringing together all of that into answering the 3 commission questions.
Fantastic and amazing to hear the angle you've taken in terms of hearing the voices of the ordinary citizens, certainly making it that much more richer. Let me move to Dr. Chunara. Considering Africa's large youth population, how should decision makers progress toward attaining universal health care? And of course, bearing in mind that we need to prioritize the needs of the youth. What are some of the low-hanging fruits in your view?
So Victoria, thanks for the question, and it's great to be checking in, and a shout out because I'm getting a few WhatsApps, for example, from Tanzania and all across. But as I sort of think about this report, and I think there's an intersection between gender and youth, and I think there's two low-hanging fruits that we can look at. The one will be the policy and legislative environment, and the other one will be the programmatic level. The first thing I want to say about youth is that we can't tailor our healthcare services just by saying youth. Adolescents and then young people are two distinct categories that we first need to think about. I think the report, for example, sheds a spotlight on service coverage. It sheds a spotlight on quality and on governance. And I want to share a very big example that sort of stuck with me since I engaged with young people in Uganda. There was one young woman who said during this community meeting that when she went to a healthcare facility, the gatekeeper was essentially asking for a $100 bribe. And if she couldn't pay the $100 bribe, she would have to pay, she would either get Panado or not get any contraceptives. So I think that's very powerful in terms of the type of quality, the governance issues which translate to the youth level. In terms of quality,
Okay, we appear to have lost Dr. Chunara. However, we will link back with her. Dr. Hakiba, I see you are back online. Let me come to you. As the driver of this whole process, we heard from your colleague, Professor Baraza, on what it entailed, talking to the average citizen to hear their concerns, to bring a different perspective to this report. But what else went into putting this huge project together?
Thank you very much, and apologies for dropping off a little bit earlier. I think what I can say is that this process was very engaging for different stakeholders and experts that were involved. Not only the commission team that made that deliberate move to really involve each and every category of actor in the field of health financing, in the field of universal health coverage, to make it happen, but it also went beyond considering the commission members and going to a key interview with specific renowned actors that are in different countries. As you know, not all the countries are the same level for the UHC, and not all the countries face the same issues. So it was important for the commission to bring in as much expertise as possible, not only on a technical aspect, but also to listen to those policy makers, to those opinion leaders that are actually supporting the implementation of the strategies that are leading to a successful UHC system in a country. So beyond those key interviewee, we also took another step to listen to the success stories that are happening in the communities. It is important that when you look at the different members of the commission, you need to recognize that there was a diverse expertise ranging from, as I said, policymakers, health specialists in health economics, health financing, social inclusion. We had renowned clinicians and also distinguished academic professors. So that expertise, alongside with the researchers' perspective, alongside the family medicine and primary healthcare practitioner, was meant to make this report as comprehensive as possible. And then the report comes also with different other documents that will really help and support the countries, the people, all the audience that will be consulting this report to grasp the best of what they can do from where they are at this point.
Fantastic. I can see Dr. Chinara is back with us. I'll give you just a brief moment to sum up what you were speaking on the governance issues and the programmatic areas of the report in respect to youth. Dr. Chinara, the floor is yours.
Really Murphy's Law that I dropped off, but just to jump back right into it, as I was saying, what we're finding with adolescent healthcare is that there are massive legislative and policy barriers, and legislative in terms of really what's the age of consent to access healthcare services. This is a massive barrier. And that's something simple that we can start to address throughout the continent. When it comes to child marriages, there's conflicting legislation between religious legislation and health legislation or child marriage legislation, and how do we sort that out? So this is really a throwback to the policymakers listening in during this conference. How can we address that? Then on the level of adolescent sexual and reproductive health policies, yes, we have them. Africa has very recent policies throughout the continent. What we need to do is to finance these policies. We need to make sure that it's really aligned to universal health coverage. Zambia, for example, has an adolescent policy that's centered on the 6 building blocks of UHC. I think that's largely exciting, and it provides sort of like gold standard for the rest of the continent. Programmatically, again, it goes back to, if we're speaking about adolescents, school healthcare services are essential for nutrition, for HIV services, yet we're seeing that there isn't enough buy-in, there isn't enough resources. School health is going to be central to universal healthcare coverage. I think we also need to think about university environments, workplaces. So we need to break down the categories of youth that we're looking at. And really, finally, within the continent and working in this space, we see that there's so much of SRHR, sexual and reproductive health, or HIV efforts. We're seeing the non-communicable disease community working separately. How do we start to bring the work and the effort together? We're looking at one adolescent, we're looking at one young person, and I think this is what we have to consider. And again, speaking to the report, when we're looking at the intersections between youth and gender, our young women specifically are facing these barriers so much more. And we need to think about this at the policy level and the program level.
I want to take a collaborative kind of tone now and bring Linda in here. You play in the private sector. Private sector will be critical in ensuring we hit those UHC targets. COVID-19 has shown us how important it is to have collaborations and partnerships and kind of solidify those relationships between government and private sector. But can we hope that there will be, greater ease in doing business across the continent and just leveraging on those partnerships between the private and public sector, in your view?
Victoria, thank you so much for this question, and it's a pleasure to join this conference. So it's a great question as well. So I'm sure you've all followed how governments and private sector companies, like my company, are collaborating to fight the COVID pandemic. What we've done is we've rallied behind one foe, the virus. What I've seen is that the private sector has been especially agile in COVID responses across almost every aspect of health systems in countries, from supply chain all the way to diagnostic services. Both sectors have actually come together in a really unprecedented way, with a willingness and openness on both sides to work together, okay? The partnerships that have been forged have been really deep, and I'm hopeful that they will remain so and get deeper post-COVID. So I want to give you an example. 7 years ago, we were faced with a potential pandemic threat, the Ebola outbreak in West Africa. Partnerships were formed between private sector and governments, okay, to build capacities for future outbreaks. Today, we are once again seeing the virus back in 2 countries on our continent. And there's unity behind one goal: let's stop the outbreak. What we cannot forget is that this kind of collaboration is possible and must become the norm. We must collaborate across sectors to work together on a single agenda, not unlike the one Amref is announcing at this very meeting. Ebola, COVID-19 have shown that it's possible when we focus and play on the same team for us to win. We must hold this spirit and channel it towards universal health coverage. And on the ease of doing business across the continent, I think that's really a good question as well. So it's this same sense of unity behind a common agenda that gives me hope for a new way of working with greater ease amongst all sectors. I believe it because I've actually seen it. Before this pandemic, in my role, I would travel to almost all corners of the continent weekly, meeting with stakeholders across the board. Now, what are we doing? We meet virtually, we speak more frequently, and the conversations have changed. We know we all have one goal and arrive at the virtual table with a singular focus. We are solving challenges together with an openness I've not seen before, Victoria. I really haven't. And in these ways, COVID has really reduced the barriers that exist between us, and has built more trust and collaboration in all the sectors. And I'm hopeful that we will continue to stay the same team. And so the collaboration that we've found can be applied to more health challenges that need our collective focus.
Certainly, and I want to zoom out a bit and take this to the global level, if you will. Honorable Bahron, you sit as a co-chair, really at the center of this effort to achieving universal healthcare. You co-chair the UHC 2030 Steering Committee. How do you plan on advancing the conversation towards getting there by 2030? And for you, what's most important in terms of, if you looked at your to-do list, what's the most important thing to hit?
Thank you. Thank you so much for the invitation. I think the most important part is political will. We need to take a decision. Yes, there's a lot about content, about implementation, about a lot of important details. But the first step is to have political commitment. And especially today on International Women's Day, we need to remind us that this is about a commitment, about a decision, but also with a gender perspective, with gender lens, and having a very specific focus on women and girls. Yes, we know that having health for all is a very important challenge. If we do not work on this agenda, by 2030, there will be 5 billion people without access to healthcare. So this is not like a random topic. This is about life or death. It's about inequalities. It's about having equal opportunities for all. So again, the first step is that this is a political decision. This is a commitment. And in my view, as a parliamentarian, I consider that it is essential to expand and strengthen UHC legislation and regulation, set clear UHC national targets, and communicate better to bring people together. There is a lack of trust that we need also to rebuild. The commitments have already been made, so accountability and transparency in progress towards the UHC agenda are essential. However, our findings still show that many countries lack measurable national targets, and the public awareness of their government's commitment is very limited. Parliamentarians have a key role here. Our duty is to represent our constituencies and to ensure that their needs and demands are actually addressed. In this regard, we can and should be a driving force in holding governments accountable for their own commitments. So being very clear, it's about legislation, about allocating budget, about oversight, and of course about representation and working closer with our communities. To that end, I would like to highlight some policy recommendations from our 2020 synthesis regarding UHC legislation, regulations, and accountability. First, governments should increase awareness among the populations about the UHC laws, regulations, and accountability mechanisms. This is essential so that people are able to hold their governments to account in meetings, their UHC commitments. Second, governments must commit themselves to set national UHC targets and communicate them clearly to multi-stakeholder audiences at local, national, and global levels. We need to translate international commitments into national realities. And for that goal, we need to work with everyone. We need to be fully inclusive. Accountability requires a common understanding of their commitments made. National targets should therefore be publicized openly and made understandable and accessible for population across the world. Third, parliamentarians will have a key role in translating the commitments made at the 2019 UN high-level meeting on UHC and the expectations of their electorate in appropriate legislation, especially where UHC laws and regulations are lacking. And finally, governments should institutionalize and mandate social and political accountability mechanisms and implement concrete plans to monitor the impacts of laws and policies on UHC. So, to be very clear, there are some countries where access to health is not properly reflected even in their constitutions and in a very specific list on human rights. Then we need to develop a roadmap. That's why legislation exists. And of course, again, budget allocation. If we are not sending budget for infrastructure, for hospitals, for the health personnel, for all the people and materials that are needed for having universal health coverage, it will be only political narrative instead of a political commitment.
Certainly, Honorable Baron, you mentioned the need to bolster our healthcare systems, especially when it comes to financing. Dr. Hakiba, let me bring you in on that. COVID-19 pandemic showed us how critical it is to strengthen our health systems. And conversations around this have really gathered voice, not just across the continent, but around the world. What challenges do you see countries in Africa facing in terms of strengthening and financing healthcare systems?
Thank you very much. First and foremost, we have to keep pushing on prioritization of health in the financing of all the countries. As you rightly said, COVID-19 just showed us that even though we all use health services, we still are underfunding those services that we critically needed a few months ago when this pandemic hit and actually revealed so many gaps, so many inefficiencies, and so many lack of attention. So I think one of the key things is after the different call for commitment to increase the financing for health that the AU supported last year in 2019, it's important that we look into how do we move from that paper-based commitment to an actual disbursement for the health facilities, for the health providers to get what they need. So the other aspect is also that there is many initiatives that are going on that have been launched. For example, the access to commodities and production within the continent. So we can no more work as individual countries. I think Dr. Tedros put it very well. He talked about how all the countries had to come together to make the vaccine a reality. Suddenly, a disease was not an issue of one country or one community, but rather a global issue. So I think that now we can see that the availability of services has to be tackled by all the countries the same way. This report is actually here to propose just that support. It will start the conversation or focus the conversation on availability of services, availability of drugs, capacity building of the personnel, possibilities of integrating the services, and the reminder that health is not an issue of the health providers. The ministers of finance today, they speak health better than anyone because it has been such a high, it's so high on their agenda. So the military, the finance, the political leaders, everybody is concerned about health. So as we move forward, COVID is here to stay again for a while. We need to remember that we had other issues, causes of mortalities before. We need to keep the focus on primary healthcare. Fund primary healthcare. We need to keep the focus of non-communicable diseases because all of those are really weakening our population. And when we talk about pandemic, it finds us in a very a poor stage of health, and we cannot combat anything. The other aspect is also the financial prioritization and the way we buy services, who we buy from. We have had a huge push by the private sector. They were a little bit dormant on the side, not being involved, not getting involved, but then we saw how much support they could bring in. And so I think the countries have now understood that we have no plan B. We need to finance the health services, and we need to be innovative in a way we do so, and we need to engage as many people as possible. And throughout the report, we see how we give recommendation at every level, all the way to technology innovation that will come and support the service delivery. And remember that putting a service to scale does not specifically mean that it has to be expensive. Engaging the private sector does not mean that it has to be expensive. We need to be intentional in how we engage each and everyone and making sure that we address the very problem that every country faces. And they're pretty similar, but then the specificity of every country are key for the success of that enterprise. Thank you.
Thank you so much, Dr. Hakiba. In the interest of time, we have to bring at least this session to a very abrupt close, but some amazing insights coming from all of the panelists, just in terms of what needs to be focused on to achieve UHC when it comes to Africa. It's not a one size fits all, as Dr. Hakiba said. It has to be targeted, it has to be customized to ensure that each country is hitting where they need to in terms of universal healthcare.